and I want other people to have that chance too.
And here to talk further about the subject is Dr. Elisa Port from Memorial Sloan Kettering Cancer Center. Dr. Port, thanks for joining us.
Sure, thanks
Boy,
for having
this
me.
is such an incredibly personal decision for a woman to have to make.
Absolutely, and one thing is for sure, and that is that no one can imagine what choices they would make if they were exactly in that position.
Let me ask you this, because, and I don't know the answer, if a woman is carrying this breast cancer gene, what are the odds that she will develop breast cancer?
Her risk of developing breast cancer for gene carriers is estimated to be somewhere between 50 or 80%.
Wow.
Most as high as 80%. In addition, the risk of developing ovarian cancer, which is small for the general population, is probably close to 20 to 40%.
The doctor in our story made the choice to remove her breasts and,
Yes.
and her ovaries.
Yes.
Is that common if you carry the gene? Are you finding that?
We are finding it increasingly because, believe it or not, gene testing itself has only been around for the last 10 years. And so prior to that, women knew they had a family history and knew they had a family history of both breast and ovarian cancer, but really didn't know what the future held for them. Nowadays, we have this test that's being done more frequently that can give women that specific information.
So does that mean, from, just so I'm clear, from birth, does a child have the breast cancer gene? So whether you got tested at 6 years old, 26, 36, or 46?
Correct. You inherit this gene from one or the other of your parents, and that's one common public misconception. You actually can inherit the gene, also the gene mutation, from the father's side of the family as well. And so when a baby inherits that mutation, it stays with them for life. Now, there is no real risk of breast or ovarian cancer when in childhood, and it's only when women get into their 20s, typically their mid-20s, that we start worrying about this risk of breast cancer first.
The doctor in our story was saying, look, I don't want to get checked every 3 months, and I can only imagine just the sleepless nights, so they she opted to have the surgery. But with any surgery, as well as this one, obviously, there are tremendous risks that come along with it, right?
Sure. The surgery, when done in young, healthy people, is typically very safe, meaning the risk of the anesthetic is quite low. The risk of blood loss and all of those is quite low. The issues is more the resulting disfigurement, the cosmetic results, the lack of sensation, the inability to breastfeed in the future. Those are the things that are really the long-term sequelae.
How would you advise a patient if the person's carrying the gene and says, look, I don't know what to do, should I have the surgery or should I not? What would you advise?
The thing to know is that without the diagnosis of breast cancer at the time, you do have time to gather information, to get multiple opinions, and to take the time to make sure that the decision you're making is right for you. And that just takes time in gathering information, and the understanding is that the right decision is not the same. One size does not fit all, and the right decision for one person may not be the right decision for someone else.
Dr. Port, good information. Thank you so much for being here. We really appreciate it. And we'll be right back.